And who doesn't want full hair, right? How do we get it? Well, sometimes we need help from Mother Nature, and sometimes we need help from Chic Derm and Aesthetics. Assalamu alaikum, Faseeha.
Walaikum assalam, Aisha. How are you doing today?
I'm doing very well. Well, with me, I have Faseeha Raza. She is a medical and cosmetic dermatology PA. And last time we talked to her about non invasive anti aging treatments, and people loved that segment. So she is back today, and we are diving deeper into some treatments in aesthetics, जैसे कि hair restoration, lasers, injectables, and even some beauty myths.
Yes, absolutely. I'm super excited. Thanks for having me, Aisha.
Absolutely. Before we proceed, I want to tell you that Chic Derm and Aesthetics is located in Allen, 1312 West Exchange Parkway, Suite 2130. Clean, beautiful place, and I loved my experience there. I got a fantastic hydrofacial, which, if one of these days I'm brave enough, I will put it out there. You can check out all the services they provide at mydermpa.com. Check them out on Instagram at chicderm as well. And they have new patient specials that are going on. So you can check those out, and they provide a free initial consultation also. So if you're struggling with any kind of issues, like melasma, acne, you're getting a little thinning of the hair, uh, go and get your free consultation because they can change your life. So, Fasia, so good to have you back on the show.
Thank you.
Let's start off with hair restoration,
Mhm.
right? What are the most common reasons for people to lose hair?
So, hair loss can be from genetic predisposition, it can be from hormonal imbalance, it can be nowadays from weight loss medications, it can be environmental, the products that we use. So, there are so many different causes of hair loss that are present and can be tackled carefully if you go for a consultation.
Mm.
Mhm.
Now, you use PRP in your practice,
Mhm.
right? What is PRP, and if you can explain how it works?
Yes. So before we get to PRP, there are many topical treatments that are available in the market, and people have been using minoxidil, for example, Rogaine for hair loss. There are other multivitamins that are available that can be used too. But sometimes those therapies do not give you the full effect that you're looking for or does not improve the hair growth
Mhm.
in general. So, a couple of things we have to do is we have to nourish your hair or nourish your scalp enough so that we do not get the initial hair loss,
Mhm.
right? And we also need to make sure that we get a consultation with your primary care doctor just to see if they can run some labs and make sure that there are not other physiological changes happening in your body that can impact your hair loss.
Jesse, anemia is a common cause of hair loss.
Exactly,
Okay.
exactly. And once we do the preliminary or the background work, then we are ready to step into other treatments, which are topical treatments, which are PRP treatments, or even hair transplant in some cases.
Mhm.
So I would say, in my experience, PRP has been a game changer for females. We want to make sure that the hair is well nourished. We are not breaking hair, we are not losing hair as often, and we are also stimulating the hair growth by increasing blood flow in your hair follicles and also making your hair stronger.
So, what does PRP stand for?
So it stands for platelet rich plasma.
Okay.
So basically, how you do the treatment is you draw blood, about 60 cc. So every practice is a little bit different. But then you kind of get a concentrated platelets in through a centrifuge,
Mhm.
and you use those platelet rich plasma and inject it in your scalp in the areas where there's hair loss.
Ah, okay.
Yes.
And how long does this take? And obviously, you numb the scalp, right?
Well, there's controversy about it. So some people do numb the scalp, some people use other modalities to make you comfortable.
Mm-hmm.
But in my opinion, numbing can be used. However, it is more, or it is better if we do not use numbing and do the injections without numbing, because numbing can sometimes minimize the effect of the PRP.
Oh, really? So,
Yes.
how painful is it?
It is not painful. It is discomforting a little bit. I would say from 0 to 10 scale,
Mm-hmm.
yes, maybe you can experience about 3 or 4 out of 10 discomfort, but totally manageable. The therapies, or the treatment I use is mainly we cool the scalp area where we are doing the injection, that actually does localized numbing.
Mm-hmm.
And after that localized cooling effect, the injection is done, so it is not as painful. Now there are some other modalities that I specifically use which make it comfortable, that we don't do single injections. I rather use a cartridge that delivers 6 injections at one time, which delivers the product in a bigger area or space, and we don't have to do minor or small doses of injections.
So, this stimulates the hair
Mhm.
follicles to start producing hair again.
Yes. How PRP works is basically platelets are the growth, they have are the growth factors in our bloodstream.
Mm-hmm.
So if you think about our blood, we have red blood cells, we have white blood cells, and we have platelets.
Mm-hmm.
Anytime we get an injury on our skin, platelets are uh, the factors that are released, or they come to rescue to improve, or you know get your injury sorted out. So once the platelets come to rescue, they release growth factors,
Mm-hmm.
which will heal your skin, increase blood circulation, and patch up all the damage that was done. So the concept behind platelet rich plasma is to release those growth factors right at the depth of the hair follicle, which is about 4 millimeters deep.
Mm-hmm.
And they're providing full nourishment, so that that hair follicle not only grows and we grow more hair, but also makes the existing hair stronger.
Okay.
Mhm.
And very nicely explained, by the way.
Yes, thank you.
Um, is it safe, number one? And how often do you need to get this treatment done?
So it is very safe treatment, because essentially this is your own blood and your own platelets, right? We are not injecting any foreign object in your body or any medication, right?
Mm-hmm.
So one of the safest treatments, in my opinion. And how many sessions you would need to get see the prominent hair growth, it would be usually 2 to 3 treatments
Mm-hmm.
over a period of about 6 months.
2 to 3 treatments over a period of 6 months. Okay.
Yes.
And what kind of success rate have you had?
So with females, I see great improvement right away, right off the bat. Somehow we do very well with the
Mm-hmm.
PRP treatments. I have seen in about 8 months, I have seen great improvement,
Mm-hmm.
thicker hair, less hair fall. So the timeline goes like this. So once you get the PRP treatment, what happens is that you notice right away within 7 days that you're not shedding as much hair as you were in the shower, for example.
Mm.
And then after that, you start noticing that your hair is now getting a little bit more shiny. It is more healthy. It is more stronger. So it's not dry as it used to be.
Mm-hmm.
It is all because of those growth factors that are just being released and the PRP working.
Okay.
And from there, after about 4 to 6 weeks, you start seeing that you're getting a little bit of more hair. Small budding hair follicles are producing, but the full effect is usually in about 8 months, when you definitely see about like 2 inches of hair growth, and the length of the hair follicle that just was born is now about 2 to 3 inches long. So that's where you see the most difference, more fullness in your scalp.
And then once you get this treatment,
Mhm.
how long does the hair stay? I mean, if you have some kind of systemic thing going on, will the hair just continue to fall then? Or tell us a little bit about that.
Yes. So the hair that is now produced is going to stay as long as the life of the hair.
Okay.
And we will make them stronger by doing those consecutive treatments, if that makes
Ah,
sense.
okay.
you may end up losing some hair later, and you can see about a year later after these 3 sessions of PRP that you are now starting to fall, hair is starting to fall now.
Mhm.
So at that time, that would be a good time to again get a touch up or do one more treatment. So I usually say if you have significant hair loss, you should get treated about 2 to 3 treatments in the first year,
Mhm.
and then rest of the years we'll do maintenance once every year. Now, also, it is very important that you talk to your provider or doctor and see what could be the other causes of
Mhm.
hair loss.
Mhm.
If you have thyroid issues, if you have iron deficiency, if there's anything else that should be taken care of first, so that all these efforts and you make to restore your hair are well worth it.
Mm. What about people who may be undergoing chemotherapy or maybe taking chemotherapy drugs? Is PRP
Mhm.
safe for them?
It is safe for them, definitely, but they may have to wait a little bit until they get the clearance from their doctor
Mhm.
to get started on this treatment.
Okay. And do you see men and women at the clinic?
Yes, I do. Yes.
Okay.
So PRP is done for both males and females.
Mhm.
And males who are good candidate are the ones who do not have male pattern
Balding.
baldness.
Mhm.
Yes. So if say you have an area in the scalp where you see no hair at all, so there's no hair follicle, then that area might not be a good place to inject PRP, because we
Mm.
do not have originally have any hair follicles there.
Mhm.
We would like to treat people with PRP who have diffused hair loss,
Okay.
meaning a little bit of hair thinning, their scalp is showing, but they still have hair
Mhm.
in the area.
Okay.
So those are the great candidates. So males who have some hair loss, or even younger males, people who are losing hair because of certain product use or environment or anything else,
Mhm.
environmental things,
Mhm.
they are a good candidate to start touching up, or I would say think of PRP as a nourishing hair restoration treatment first, and then as a hair production treatment second.
Okay. Very, very good information. I learned so much about PRP. Now, PRP and PRF are also used
Mhm.
for the skin, right?
Yes.
And we keep hearing about these vampire facials. So tell us a little bit about both of these and what's the difference?
Right. So PRP and PRF, PRP stands for platelet rich plasma,
Hmm.
and PRF stands for platelet rich fibrin.
Okay.
And the difference between both of them is one of them has a quick onset,
Hmm.
meaning once it's delivered, it works for about 6 to 12 hours and releases all growth factors in the area. So that is the PRP.
Okay.
And when we talk about PRF, it is a platelet rich fibrin. So it has a fibrous layer around the platelets that will release the factors over time. So it's like delayed release response.
Hmm.
Delayed release means that we are releasing those growth factors slowly and at a very continuous pace. So meaning up to, 12, 6 to 12 weeks, so that's the time frame for release of PRF versus PRP.
Hmm.
One can be superior than the other
Okay.
depending on the what we are treating and how much improvement we need for the hair growth.
Oh, for the skin
Yes,
regeneration.
right.
What are the effects that we can see on the skin by
Mhm.
using PRP and
PRF.
PRF?
Yes. So going to your point that using PRF and PRP for skin rejuvenation
Hmm.
is another ball game.
Hmm.
It has been used for a long time, like you said, like vampire facials. It gives a very nice glow, and it gives you a very nice, collagen production and everything. I use both I do both PRP facials and PRF facials. The distinction between them is PRF, I use it for more so adding volume as natural filler,
Hmm.
as well as giving you a nice facial with it. So PRF is used for localized volume enhancement in the face, such as under eye treatment. It is very popular,
Hmm.
and then nasolabial folds. And then we, at the same time, we are using your PRP that we just collected
Hmm.
all over the face as well.
Oh.
So that's how both PRP and PRF work together, in my opinion, for skin rejuvenation.
Okay.
Yes.
And you can call in with any questions for Faseeha at 972-501-9390. I'm in conversation with Faseeha Raza of Chic Derm and Aesthetics. They are located in Allen, and you can check them out at mydermpa.com. That's mydermpa.com. They have a lot of new patient specials and see what all services that they offer, and they also do a free initial skin consultation or hair consultation. We talked a lot about
Exactly. Yes.
hair
Restoration.
restoration. um, Talking about hair, some people want to add hair, some people want to remove hair. And laser hair removal is very popular. But I think one of the biggest things that we as an end user do not know, and that is about the device.
Mhm.
So why is that important?
Yes. Believe it or not, this laser hair removal device quest for me was also very, very interesting one.
Hmm.
As a provider, when I went into looking for a laser hair removal device for our practice, I had to do about 2 years of research before I came up with the perfect device for my clientele. My patients,
Hmm.
the people I see, the skin, the color of the skin, and the skin types and everything like that. So it is so important to know which device will work most safely for which skin type,
Hmm.
especially in laser hair removal, because there are so many side effects that can happen.
Really? Like
Yes.
what?
So, like hypopigmentation, meaning the change in color of the skin,
Hmm.
if the laser is targeting a melanin, or which is called the cells of color, then it can actually cause lighter pigmentation on your skin. And because some of the laser out there are targeting the hair follicle, so they are made to target the dark spot in the skin,
Hmm.
you don't want to use a laser that is just random and it just targets all pigments. So you want to make sure something that goes to the exact depth of the hair follicle
Hmm.
and it bypasses the top layer of the skin.
Okay. All right. We have a caller, so let's see what they have to say. Radio Azad, you're on the air.
Hello and Assalamu alaikum, Aisha and Faseeha Raza.
Assalamu
Walaikum
alaikum.
assalam.
वालेकुम सलाम। तो मेरा ये इतना अच्छा प्रोग्राम और आप इतने अच्छे से बताती हैं फसिया, ये सब चीजें हम लोग पहले सुने भी नहीं थे। द इंफॉर्मेशन व्हिच यू गिव इज सो एनरिचिंग एंड सो informative, let me put it this way, never heard about PRP and all. So मुझे ये पूछना था कि is there a downtime after you do that, whether for the hair or the skin?
Ji.
Great question.
Thank you so much for listening to our show. And I'm very happy that you're getting the information and new information, which is more educating and helping you understand how different treatments work. So, before we talk about downtime, I wanted to actually tell the listeners about how this treatment is done. So, PRP for hair restoration is done, like I said, with injections. It can be also done with the laser, and you do the laser first and then you infuse or the PRP in the scalp. It can
Mhm.
also be done as a combination of microneedling and PRP, which is much more tolerable for younger patients. So if I have a younger patient, a teenager or a person who's in 20s and they're not willing to go through the treatment of they're not, I mean, discomfort would be one of the things they don't want to happen,
Mhm.
then we have other modalities that we can use for that. Now, downtime wise, the scalp treatment is done within an hour. And then after that, you may have a little bit of tenderness on the scalp only if you touch your scalp. If you
Okay.
do not touch your scalp, then you should not have any discomfort or pain post treatment.
Mhm.
The only discomfort is during the treatment, which is very well managed with localized cooling of the scalp with the instruments that I use and making it more comfortable for the patients. So, not really necessarily a downtime. What I recommend for my patients is, of course, not to go and exercise right away or go to the gym or in an environment where they can touch a device and then touch their head, and that can cross contaminate the skin. So we want to make sure that your hand stays clean and then you're not sweating too much and
Mhm.
you're not moving bleeding too much, because essentially the blood circulation in the scalp increases, and then you may end up bleeding a little bit more, or something can happen. So I say just 24 hours of light exercise. Just stay in a cool environment, make sure you're not out in the sun, direct sun. That's pretty much it. Usually people take shower that same night, and I say do not take shower with hot water. Instead, use warm water, because we don't want to dilate those vessels or
Mm-hmm.
cause any more inflammation on the scalp. So basically cooling skin down.
Mm-hmm.
And then by the next morning you're good to go. Honestly, you don't feel anything next morning unless you touch your scalp a little bit. Maybe it will be a little tender.
No scabbing.
No scabbing, nothing like that, because there are no cuts. The treatment is done with very small, tiny, microscopic needles. Now, it is also very important to use the correct depth and the correct needle. Okay.
Mm-hmm.
That is something that is not known by a lot of people.
Okay.
So, the one that I use, I get it especially from Germany. It has, of course, like I mentioned, it is a cartridge that has about 6 pins or needles, and that only goes to 4 millimeters deep.
Mm.
And why 4 millimeters is because it is the depth where the hair follicle is present.
Okay.
Okay. Secondly, downtime for PRP facials or PRF treatments. Now, PRP facials, if the listeners do not know, I would like them to know that this is done in combination with microneedling treatment.
In combination.
Yes.
Okay.
So a PRP treatment for face consists of a microneedling treatment and a
Mhm.
PRP treatment.
Okay.
Okay. And how this is done is we numb the skin first. Of course, for the face, numbing is required. And we do the microneedling passes first, making sure we build that collagen, making sure we tighten your skin, making sure, over time you don't have those fine lines and wrinkles, the pigmentation improves. So that is what microneedling is doing when I'm doing that. And then when we collect your PRP, we take it and do the with the microneedles, we infuse that PRP in the skin.
Okay.
Now, microneedling device actually targets goes down to 2.5 millimeters.
Mhm.
So imagine you're taking a small device or the needles that are going in and out. Of course, you're not feeling it. Don't be worried. You're not going to be in discomfort at all. It is very comfortable treatment. But in and out, and we are adding the PRP on top, and we are refreshing the whole skin, just like we are seeding the lawn
Mhm.
for next season or aerating the lawn with the
Right.
tilling.
Uh-huh.
I didn't know about it until I got it for my own lawn, and I saw
Yeah.
thick, lush green grass, right?
Mhm.
So
Mhm.
same concept when we do this for skin, and we hydrate it with those growth factors, it just comes back so beautifully, fresher, beautiful, clear. The glowing effect of PRP lasts about 6 months, and so I say once a year, PRP with microneedling is the best treatment you can get.
Makes us want to get it right away. Okay,
Yes.
so much information. I had no idea. I'd always heard about
Yeah.
vampire facials, but
Mm-hmm.
I didn't have any idea about what it entailed. So, so going back to laser hair removal,
Yes.
right? So the device you were talking about how important it is to get
Mm-hmm.
the right device. So for especially for our South Asian skin,
Yes.
what should we be looking for?
So for South Asian skin, we are usually between Fitzpatrick 4, 3, 4, and up to 5, right? So
Okay.
there are six skin types. 1, 2, 3. We are 4, 5, and then 6.
Mm.
So very important that we do not use a light-based laser hair removal device.
Hmm.
Okay. So light-based laser hair removal devices are IPLs.
Okay.
So, how IPL, which is intense pulse light, I just want the listeners to know that IPL is not a laser hair removal.
Hmm.
IPL is a light based device which is targeting the full skin and targeting the color of the hair follicle and heating it up. And of course, by doing this treatment and heating the hair follicle at the root, you are basically minimizing the hair density. You're making them less thicker and eventually getting rid of them.
Hmm.
But because it is light therapy and it scatters all over the skin and doesn't have a specific target,
Hmm.
right? It will touch our other pigmented cells, and it can overheat the pigment of our skin
Oh,
and can cause like burns,
oh.
or if not used appropriately. I'm not saying that you will always get it. I'm saying the reason why I do not prefer IPL over 1064 Nd:YAG laser, which I use,
Mm-hmm.
is because of this reason. I want to treat just the hair follicle. I don't want to treat other pigment in our skin.
Mm.
Does it
So
make sense?
important. Yes, absolutely.
So there are devices like Alexandria, which
Mm-hmm.
is 755 wavelength laser. There is a diode, which is 810. Then there is 1064, which I use. I sometimes use a blend of three lasers because our skin types are so different. We can be a combination. We can be a little bit lighter skin tone, although ethnicity is something different.
Mm.
So very important to choose the right device because of the side effect profile.
Right. Yes, and we started talking about that before we
Yes.
got our caller. So going back to side effects that
Yes.
lasers can cause. So you talked about that it can actually cause hypopigmentation. That means the
Absolutely.
whitening of the
Hmm.
skin in patches,
Exactly.
right?
Or hyper sometimes.
Or hyper. How
Overheating.
how do you know that you're going to react this way? How soon after getting your treatment do these things occur?
So, for example, if you're getting a IPL laser treatment, you will see post treatment that you have a lot of inflammation in the area. Inflammation meaning redness, right?
Mm.
Redness, irritation that lasts for a long time.
Okay.
Now, that inflammation in our language we call post inflammatory hyperpigmentation, and it causes post inflammatory hyperpigmentation. So, inflammation or redness that stays for a long time has a chance of giving you a hyperpigmented skin. Okay.
Ah.
So if, for example, that device was used for at a higher heating settings,
Mhm.
that can cause hyperpigmentation, or it may touch your melanin cells called hypopigmentation.
Okay. I've also heard that laser hair removal can have the opposite effect that you want, and it can cause increase hirsutism, right?
Mhm.
Tell us about that. Why does
So,
that happen?
yes, in some cases, I have seen that if the treatment is not done at the correct frequency,
Mm-hmm.
meaning laser hair removal worked like this. You have to get treated every 4 to 5 weeks or 6 weeks for 6 sessions, right? If we stop doing the treatment, I have seen the patients who give a longer gap, 8 weeks of break, and they come back, their hair is going to get a little bit even more than the baseline, right? The reason is the skin, the hair follicle kind of getting used to the treatment and coming it even more viciously. Now, it should not increase the number of hair follicles. It is whatever it is in your skin,
Mm-hmm.
but you may see that after first treatment they got a little dormant, they were trying to die, they were trying to go away, and they were getting thin and weak, right? And then we gave them too much time in between, and they're coming back now very healthy and growing back.
In full force.
Yes. So you have to make sure your treatments are done at right frequency
Mm-hmm.
as recommended by your doctor, and just get done with those 6 treatments all together,
Mm-hmm.
and then maintain it over time, and that should be fine.
And when you say maintain it over time, means what?
So I would say next year, after 12 months or so from your first session of first 6 treatments, you may need another treatment in next year, maybe one or two, just to touch up and making sure that the new hair follicles that are coming in, or new hair that are coming in, we tackle those so that you don't get extra hair.
And laser hair removal is permanent, as in you just need touch ups then once a
Yes,
year?
once it's done, you're done. You're good to
You're
go.
done.
So I think that it increases your self confidence, especially in terms of facial hair.
Mm-hmm.
In some, cases, you will see we have a little bit more facial hair. That is something, and then people who play a lot of sports and they want to get treated. That's also a good idea. I think it's just a confidence booster, in my opinion.
Yeah, absolutely. And people think, oh, it's going to be very expensive, but
Mhm.
no, I mean, trips to the salon for waxing and threading, I mean, I think it all just works out in the end. It's actually less expensive.
Exactly.
All right, let's take a caller. Radio Azad, you're on the air.
One quick question: are the treatments same for men and women? Because of the different skin types, follicles वगैरह का difference होगा.
Mhm.
So are the treatments safe for men and women? And another question: is there such a thing as a red laser comb? They're showing it a lot of home shopping network and all about a red laser comb which you put on your head, or like a cap which you put and hair grows. Just these two
Hmm.
questions I had. Thank you
Excellent.
so much. Thank you.
Excellent
Thank you.
question. And just backing with that, I have seen that now on Insta and TikTok and all these, they are actually selling these laser devices that you can use at home.
That's true. Absolutely. I have seen those devices too, and my patients have used those devices already.
Okay.
And I say that those devices, because they have to make it so safe,
Mm.
they don't have the full energy that you need to get rid of hair faster.
Hmm.
So you may end up using it for up to 2 years for a very small area, and then yes, you will get end up getting the results. But who has the tendency to wait that long, and also patience for it to go for that long? So those devices work sometimes, but not effectively, in my opinion. And because their energy is so low, it takes you a long time to even see the results.
I see. Okay.
Yes.
So the difference in laser hair
Mhm.
removal for men and women.
Yes, so it's the same treatment. We go by the skin type
Hmm.
and the color, your ethnicity, your eye color,
Hmm.
your hair color, your skin color.
Okay.
So the way you tan,
Mm.
how sun impacts your skin. So as a dermatology PA, this is something that I was trained on, just to evaluate the skin in entirety and know evaluate the patient's skin and know what would be the right treatment for this patient or this skin type.
Hmm.
So once a patient comes to my practice, they fill out a survey or skin assessment. Actually, they pick up they tell us what do they think that their color of their eyes are, skin is, everything. And based on that assessment, I also look at it, and then we kind of put them in a category where we think that this is their skin type.
Okay.
And just looking at the skin type for males, treatment is the same.
Hmm.
Intensity can be changed. Now, laser hair removal treatment is very customizable treatment, but unfortunately, a lot of people do not have the knowledge to customize it too much.
Okay.
Does it make sense? Because
Yeah.
unless you are confident and you know what settings you can change up and down or customize for this particular patient, you're always afraid of doing it. And when you do not do it, you do not see the results. So
Mm.
for some people, I have to choose very mild, low settings. For some people, I have to choose above and beyond off label settings for
Hmm.
laser.
Hmm.
And that's how males, depending on, actually, the hair color has to be darker, and that gives the result.
Okay.
Mhm.
Excellent. Excellent. And our caller's question about red laser comb.
Yes.
And let's take another caller. Radio Azad, you're on the air.
Assalamualaikum, Asha कैसे हैं?
Walaikum assalam.
मैं डॉक्टर साहब को अच्छे डॉक्टर आई मीन आई एम सॉरी आई एम जस्ट स्टार्ट लिसनिंग अबाउट द लेजर आपको
No,
वेलकम करती हूँ ओके
no,
जैसे
she's.
आई हैव अ क्विक क्वेश्चन हियर
Hmm.
so a few years back maybe 5 6 years back I was at the laser place and stuff so there was an older lady came which she has like a hair type of like salt and pepper
Hmm.
and then I heard that the technician was saying oh once you have white hair you're going to get the laser so it got stuck to my mind for some reason I don't know if it's true or not. That's all I wanted to ask.
Great, great question. All right. So if you have white hair, can you use laser hair removal on that?
Unfortunately, not.
Not.
The reason is because most of the lasers, they target the hair pigment,
Mm-hmm.
and if there's no pigment, it is not possible to get rid of the hair.
Mm.
So 1064 ND-YAG laser goes down to the root and heats that hair follicle, and that's the target. Every laser has a target. It's
Okay.
called a chromophore in
Oh,
our language.
okay.
So in some lasers, the chromophore is water. Some lasers, the chromophore is pigment. So just like that. So to answer, yes, if you have light color hair, blonde or white hair, blonde hair would be very hard to treat, and white hair impossible. So I would not waste your money or energy in doing that.
Mm-hmm. Okay. How soon, like at what age would you recommend one can get laser hair removal done?
Starting from 16.
16. Okay.
Yes, I think that's a good age. If the kids, especially, they're growing, the girls,
Hmm.
I think that they can get started. Yes.
Okay.
Hmm.
Okay. All right. Excellent.
Thank you.
Anything else you'd like to add about laser hair removal?
Yes. So there was a question about the
Yes.
red
Great.
light comb and caps that are out
Hmm.
there for hair stimulation. Um, Concept with those devices are that you place those caps on the head. It increases the blood flow or circulation to the scalp, and then in return, we are just bringing in more growth factors to that area and causing some sort of hair rejuvenation. Right. Usually, those treatments are not very effective, in my opinion, and I don't see too much of a hair growth or restoration
Hmm.
like PRP does. Like it will bring in or make sure that the dormant hair is now growing. In this case, the existing hair may get a little bit better, but the efficacy of these treatments are very low.
Hmm. Okay,
Mhm.
good to know. Good to know. Let's shift gears a little bit and talk a little bit about injectables. I've
Yes.
often heard this tossed about Sculptra.
Yes.
What is Sculptra, and who's the right candidate for it?
That's a great question. And that's one of the very popular treatments out there.
Okay.
And a lot of people don't know about it, but they have for sure heard about it,
Yeah.
right? So Sculptra is a PLLA composite, which is polyl-lactic acid,
Hmm.
and it is made from grounded absorbable sutures.
Okay.
And how the it works is that it is reconstituted and it is delivered underneath your skin, and the body thinks that there is a foreign object right there. I need to um, pull in my defense mechanism and absorb this product, and in return it starts the healing response or building more collagen and elastin around that particular molecule,
Hmm.
and in return we see more hydration, collagen building, elastin formation, and more fullness. The effect of a filler without a filler.
Oh, okay.
Yes.
That's that's good to know. How long does it last?
So Sculptra is not a quick fix treatment, just
Hmm.
like any other HA fillers. So HA fillers are when you deliver it, you see the volume enhancement in certain areas, say cheek enhancement or jawline definition and all that, or lip volume. But
What is HA?
HA is
Hand.
hyaluronic acid.
Okay.
Hyaluronic acid fillers are most commonly used for lip filler, cheeks, and all that stuff.
Mm,
Now, Sculptra, because it lasts a long time, up to even 5 years, and it keeps producing that collagen naturally, it is considered a maintenance treatment. Okay,
acha.
so it is an anti-aging maintenance treatment where you get Sculptra, especially in the mid cheek area,
Mhm.
and you get see the facial rejuvenation over time. So when you get it done, within the 4 weeks, you reach a certain milestone. 8 weeks, your skin starts looking even more fresher. 1 year down the road, you look about 3 years younger. 2 years down the road, that's how it works. Basically,
Mhm.
it is an investment in your skin, and it is a treatment that builds collagen over time in a very slower pace and gives you more natural results.
Interesting. Okay.
Yes.
There's so many different types of Botox and fillers out there. So how
Mhm.
does one choose? How do you know what's right for you?
Exactly. No, that's very common, question. And a lot of my patients come in. First of all, I try to just educate them about what is Botox,
Hmm.
what it does, what is a filler. Sometimes there's even misconception about Botox and filler.
Yeah.
So people sometimes think that fine lines and wrinkles can be improved by using a filler,
Mm,
which is not true. Filler is only used to give you volume in an area which lacks volume.
I see.
Botox or neuromodulators, they are used to minimize the muscle contraction and get rid of fine lines. So that's the
Mm-hmm.
difference between them. And now each category has different products in it, and then you hear about them. For example, in neurotoxins, you hear about Botox a lot, which is a brand name actually. It's not the name of the medication. And then we have Daxxify. That's another neurotoxin. Then we have Dysport.
Mm-hmm.
Then we have Xeomin. And each product is a little bit different from the other. Is the composition of the product, the result of the product, how long a product lasts, what kind of improvement you see from one versus the other, all of those things. As an injector or as a person who treats patient, I know that this patient would benefit more so from Daxify versus Botox.
Mm, I see.
Let me give you an example, make it easy for you. So we're just talking about neurotoxins right now.
Mm-hmm.
Why would I choose Daxify instead of Botox for a patient? If a patient or a person is working out every day, more than 30 minutes a day, they are very active, and they have very strong facial movements, they will be a great candidate for Daxify. Because Daxify is a stronger product,
Mm-hmm.
it holds it better, and it lasts longer. So they're not going to digest this product very quickly
Okay.
compared to a person who has normal routine. They just go occasionally for workouts, they're not super active, and in previously we have seen that Botox works best for them. They would just get treated by that.
Mm, okay.
So for each product, the onset of the product, like how quickly it kicks in,
Mm-hmm.
and the longevity, how long it gives the results, is different.
Got it. Okay. So you have to go to somebody who knows.
I'm sorry, I'm giving a lot of information, which is probably a little bit hard to, comprehend when you are just stepping into aesthetics. But I think that you will remember this conversation, hopefully, when you go sit in that chair with the person who you're going with,
Mm-hmm.
and you can be more knowledgeable and educated about different things by knowing all this information. And that's what my goal is, for you to be an educated consumer.
Okay. And we just have a couple of minutes. Very quickly, Fasiha, we see social media full of all these myths and promoting this product and this
Mhm.
this facial and all that kind of stuff. So we've heard about this called salmon facial.
Yes.
What is that?
So it is called the salmon DNA
Okay.
facial,
Okay.
basically, and it is extracted. These are basically stem cells. They are used for skin rejuvenation, hydration, improving your skin texture, tone, and fine lines.
Mm-hmm.
There's a big craze about it, but I want you to make sure that I want you to know that there are not many studies that have been done that support the improvements that have been claimed yet in the Instagram or social media
Mm-hmm.
areas.
Mm-hmm.
So it is right now in Japan, Korea, and different countries in the world are experimenting this and using this product for skin rejuvenation,
Mm-hmm.
and it is getting a lot of buzz about it. But in US per se, right now, it is not an FDA approved treatment so far, and there are not many studies done that support the or claim that the skin rejuvenation that it is claimed outside the US. So on the side of caution, I would say wait a little bit before you step into getting salmon DNA facials. They may be very good option moving forward in the future, but I say that we are waiting for the studies to show us that they really work.
All right. Let's quickly take a caller. Radio Azad, you're on the air.
जी अस्सलाम वालेकुम आयशा
Walaikum assalam.
जी I have actually two questions.
Mm-hmm.
One is if somebody is doing their regular exfoliation on regular basis, then how many times they should go for a special treatment in a spa or something like that.
Mm-hmm. Okay.
And the other one is if the if you are using a Botox products and these are alcohol free, paraben free and nut free and everything, how effective they are.
Okay.
Serums, serums, yeah.
All right. Thank you so much for your question.
So the first question was, if you're using an exfoliant, how often you need to go for facials?
Mm-hmm.
I say that if you are struggling with pores, enlarged pores, or textural issues after doing the exfoliation, still, you should go for hydrofacials at least once in 2 months.
Mm-hmm.
Just to get your skin more cleansed, because this is more like vacuum suction and infusion. This would be a little bit of a superior treatment than just doing the at home exfoliation. I personally recommend hydrofacial once a month, but even if you can get once in 2 months, that's also good, in my opinion.
Mm-hmm. All right. And let me just take a short station ID break and then we will continue. This is Radio Azad, where your voice matters. Streaming in Dallas, Fort Worth, and all around the world.
आप सुन रहे हैं रेडियो आजाद हम सफर हमजाद रेडियो आजाद
All right, you are listening to Radio Azad, and with me I have Faseeha Raza. She is from Chic Derm and Aesthetics, and boy, what incredible information are we getting today. Going really in depth as much as we can on aesthetics. Okay, another myth is well. Let's answer these two questions that our caller had. So
Mhm.
one was the regular exfoliation. You said hydrofacial every 2 months. That's great.
Yes.
The other question that she asked was about Botox.
Mhm.
Whether she's using or has heard about alcohol free and paraben free and this free and that free. How effective is that?
It's very effective. It starts working within 7 days and
Mhm.
it continues to work for 4 months. There are some products that are vegetarian basically, and Dexify is one of them. So it's free of any impurities, and definitely works great. You have to try it and you'll love it, in my opinion, if you're the right candidate.
Okay, good. Get that initial consultation. One of the things that scares a lot of us is when we see all these people who've got overdone fillers. What is the truth about that?
Yes, unfortunately, in this industry, a lot of information is shared. Pictures are shared that are of overdone lip treatments or filler treatments.
Mm.
That is not true. Sometimes it is used for social media for to gain more attention, more followers. You know, people are not. They're not going to. Necessarily look at a good treatment and rave about it, but more so they're going to rave about it if there's something that's gone wrong, unfortunately.
Mhm.
Fillers are very safe. I think they can be treated, they can be used very precisely,
Mhm.
and fillers give a very natural look if a trained professional is doing your treatment. You do not have to look overdone. Nothing should be overdone, in my opinion.
Yeah.
We should be just enhancing your natural features, adding that little bit of volume where it's needed.
Okay.
Yes.
And another myth that we see is if you get Botox, then your expression is going to be frozen. Right?
Yes, yes.
True? Not true.
Well, you can get a frozen look if you desire for a frozen look. So I have patients who want to look
What?
frozen. Yes.
Why?
It's just they don't want a single line on their forehead, for example.
Oh.
But 90% of my patients who come in, they say, Fasiha, I don't want to look frozen. I want to still look natural. I don't want anyone to see that I got any treatment done, but I still want to look beautiful.
Mhm.
Same thing for fillers. And I assure them that if you don't see anything artificial on my face and my facial expressions, most likely you're not going to get it too. And I'm all for natural beauty, enhancing it naturally with the right treatment, using less product, but giving you the maximum result.
All right. Wow. So much information, so much insight. I think our listeners are really, really going to benefit from all this, and which is the point of you coming on the show and getting all this great information out there. Anything else that you would like to add? Any advice for our listeners?
I would say be educated, learn more about these things, but not from Google.
Oh,
Learn from a provider. That
Okay.
is why most of the providers, they
Mm-hmm.
have cosmetic consultation that is complimentary. I do
Mm.
it just because of this reason. I do not want you to go anywhere thinking that you don't know what you need and choosing the right or wrong treatment for yourself and then later regretting it. There is so much out there. These treatments are very expensive, they cost a lot, and you want to use or do the right thing instead of wasting your hard earned money in things that are not going to make a difference for you.
Yeah.
So I would say always get a consultation from a specialist and go from there. The other thing I wanted to bring it to the listeners is we are having an open house on October 9th
Mm-hmm.
between 4 p.m. and 8 p.m. I usually host those for people to come in and meet me and meet our staff, look at our practice, and have a good time. We talk. I educate my patients and new clients who come in, and there are some live demos. So I'll be doing a lip filler in front of you to see, how it's done, how
Mm-hmm.
natural it looks. And we have usually have very nice giveaways and stuff like that. So Aisha, you're welcome to bring
Thank
your
you.
friends and family. I would love to see you, and any of the listeners, please do mention that I listened to you on Radio Azad and I came today after listening.
Great. And you will get special pricing that day if you sign up for any service, correct?
Exactly, yes. So
Okay.
that is once in a year we offer all our treatments at a very special price. And that's how basically I think that the patients who are stepping into this is a good opportunity for them to take advantage of those special offers.
All right. So October 9th, 4 p.m. to 8 p.m., Chic Derm and Aesthetics is located at 1312 West Exchange Parkway, Suite 2130 in Allen. Their phone number 469-466-2727. That's 469-466-2727. Their website mydermpa.com, and look them up on their Instagram handle at Chic Derm. Faseeha, an absolute pleasure to have you on the show.